This issue of addiction has touched everyone. Everyone has had a family member, a friend, a loved one whose life has deteriorated because of addiction, not only from opioids, but from tobacco, from alcohol. We're in a unique position at St. Louis U as a research institution and as a Catholic Jesuit institution to look very broadly at what are all the things that have come together to create a perfect storm with the opioid epidemic and with the problems associated with that. We're developing here at St. Louis University the Center for Substance Use Disorder and Pain Management. We're pulling together folks who are already doing this work, and we want to see how can we create an infrastructure to really accelerate this growth. I have not seen any other institution be this bold in terms of an idea. We have so many tools in our tool belt here at St. Louis U to create this very broad, ambitious initiative, which not only reflects the values of our university, but allows us to engage more fully as a regional leader in this work.
Family and community medicine is a biopsychosocial approach to health, so they really take the mind-body relationship seriously. One of the first projects we started was the study of chronic opioid use and depression. There have been no studies prior to this asking whether prescription opioid use led to depression, but we found the longer you use, the greater your risk of developing new onset depression. And what it's going to do is make it more difficult to manage the pain, create a cycle of increasing exposure to opioids, higher doses, and this cycle that kind of feeds on itself. We have to start thinking about what are these upstream risk factors like mental health that really need to be addressed as part of pain management. Any work that focuses on prevention, I think, aligns with SLU's mission. We're informing the primary care that's being given to our local community. The more we understand opioid use, we're certainly caring for our fellow man.
I'm a medical sociologist and a socio-legal scholar, and I do research at the intersection of healthcare and law. The current project is using the opioid crisis as a way of understanding how two fields, healthcare and criminal justice, manage the same social problem. A lot of my work has been with pharmacists. They are the ultimate gatekeepers to the medications that we receive. And I ask them, you can see when people are getting addicted to their medications. What resources do you have at your disposal? And they say, nothing. Maybe I have a list of treatment centers that I can give them, but that's basically it. Prescription drug monitoring programs. Missouri is the only state without one, but a prescription drug monitoring program is one tool that belongs in our healthcare providers' toolkits. We have to figure out how we can make them more meaningful entry points into the healthcare system instead of meaningful entry points into the criminal justice system. One of the major benefits of teaching at SLU is getting to work with SLU students. They are extraordinary. I run a research team of about 30 undergraduate students. They get to participate in the production of knowledge, not just the consumption of knowledge, and it also prepares them for their future careers.
Neuropathic pain is one of the most difficult pain states to manage. About 15 to 30 million people in the United States alone suffer from neuropathic pain. Neuropathic pain arises when the nerves are damaged. Traumatic nerve damage can be damage caused by cancer drugs. There are really no effective medicine for those patients. The two main areas of research in my laboratory: development of novel non-opioid-based medication and development of adjunct so that the opioid can be used at very, very low doses and mitigate all the adverse side effects. We've discovered some really critical pathways that allowed us then to identify novel agents that we can use to inhibit the development of neuropathic pain. And some of those are going to go into clinical trials quite soon. We do a lot of collaborations with MD Anderson, for example, the University of Rome, the University of Florence, and SLU is very collaborative as well. There's a lot of good research done here. It's all about helping others and helping people to come up with something that will alleviate human suffering. It's been a passion of mine for many years. We're getting there slowly but surely, we're getting there.
So much of what we do well here at SLU is grounded in community in St. Louis. Interacting with our partners in the community, our neighborhoods, our citizens.
SLU has really positioned itself as a community ally. So many people across campus are doing work that has a meaningful impact.
Great scientists, a highly synergistic venue.
The energy and commitment and investment in research at SLU in the past 2 years has probably been the greatest since I've been involved in SLU, and that goes back 25 years ago.
These issues touch all of our lives. We can learn together and we can find ways to support each other.